Like to welcome everybody back to Alabama Care. Today we have Mrs. Davina Patterson, the Executive Director of the Disability Resource Network, and we're going to be talking about all of the things that they do in Huntsville and the services that they provide to individuals. And at this point, I'd like to hand it back over, Mrs. Patterson, if you would introduce yourself.
Well, good morning, and thank you guys for having me. I'm so excited to be here. I've heard great things about this network, so it's always a pleasure to be in good company. But I'm Davina Patterson. I'm the Executive Director for Disability Resource Network. Our office is located in Huntsville, Alabama, but we do service 13 counties in North Alabama.
And are you originally from Alabama?
I am. I'm a native of Alabama.
And so we always like
I'm
to
from,
ask,
oh yeah.
go ahead.
Yeah, I'm from Southeast Alabama, but I am from Alabama. Yeah.
Is it Roll Tide or War Eagle?
Oh, it's War Eagle.
Yeah. I feel like that was the first question I was asked when I crossed the state line.
Oh, you
It's
have
like,
to. Absolutely.
you got to pick your side. So, what exactly does the Disability Resource Network do?
Well, Disability Resource Network, we're a Center for Independent Living, nonprofit, cross disability, non residential, consumer controlled organization. And we provide five core services. And the services we provide are independent living services for people with disabilities.
And I feel like that's a really big resource. And there's a lot coming from the state in and for individuals that are wanting to live that independent life. You know, we have it used to be like institutions and now more three-person group homes, and now it's moving toward living in your own apartment, so that these resources that are going to help individuals are helping this process go through. Now, what's some of the history of the Disability Resource Network? Like, when was it founded? And
Yeah, so we can definitely talk about that. So, Disability Resource Network, I came on board in February of 2020. So, when I started with the organization, I was told that the Centers for Independent Living and the State Independent Living Council were trying to create and form a new center for the North Alabama region. There were currently three existing centers, one in Montgomery, Mobile, and Birmingham. So there was funding that was set up for a center to be created in the North Alabama region. And I was told that that's the center that I would supervise and have oversight over. But until that center met the state requirements and did something what they call a spinoff, I had to work under another center, under the umbrella of another center till we meet our state requirements, and then we spin off. Well, we completed those requirements and we spent off October the October the 1st of 2021. So we're currently, and we've been operating as a freestanding center for independent living, independently, effective October the 1st of 2021. We currently have about 10 board members, and then I'm the executive director, and we have two peer advocates. So that's pretty much our history. We're very new organization, and we're growing and building onto our history.
well, congratulations on passing all the certifications. And if you don't mind me asking, what was the umbrella? What was the other organization that you were working under during that time?
Well, I'm sure you're very familiar with this other Center for Independent Living because it's located in Birmingham, Alabama, and it's called Disability Rights and Resources.
Yep, Mr. Dan Kessler. I believe he retired recently.
He
And
did. He did.
I'm unfamiliar with who their new executive director is, though. So I'll have to reach
They
out and see who that
do.
is.
Yeah. Yeah, they do have a new executive director. His name is Mr. John Roper. So he's very new. I'll have to give you his contact information when we get offline. Maybe
Yeah,
connect
but
you guys.
I appreciate that, and it's awesome to be able to work under DRR for those that first year or those first few months, and kind of get that experience, and then branch out on your own. I think it's really important for success to have like a great mentor, someone that's been through it and can kind of guide you along the way there. because in the end, we're all wanting to do the same thing, and that's make a difference in the lives of these individuals.
Absolutely.
If ever you're going to start like an independent living program and organization, to have that experience with DRR and Mr. Kessler is a great experience there. So, what about your journey to executive director, even before Disability Resource Network? What does that look like? College, after college, kind of take us through that.
Sure. Well, I attended University of Alabama at Birmingham. I received my undergraduate degree there. While I was there, I worked at a couple of hospitals and clinics in the area. So I have a career for approximately over 15 years in healthcare. While I worked for those hospitals, I pretty much worked entry level positions. I did complete a management internship in corporate compliance at Children's Hospital of Alabama, but my actual paid jobs were just pretty much entry level positions. But I had a breakthrough in 2015. It was 2015. I had a breakthrough. I received my first leadership management position. I was hired as the business manager for a federally qualified community health center. And when I worked for the FQHC, I had oversight of three locations. So I managed three clinics within Northwest Alabama, and we primarily worked with underserved and unserved communities, a lot of uninsured and Medicaid patients. So while I was there, I really enjoyed working for a nonprofit. I gained a lot of interest in nonprofit management. The organization was based in Mississippi. There were over 25 clinics within the Southeast, so Alabama, Mississippi, and Louisiana. And our corporate office was in Mississippi. So that's where all of the executive and the senior leadership positions were, which was my ultimate goal. I wanted to get into senior management, executive leadership roles, but I was pretty much stabled here and settled here in Madison or North Alabama, so that really wasn't going to work. But I still had that spark, that interest for nonprofits, so I saw opportunity for a director for Center for Independent Living for North Alabama, and when I saw it, I looked over it. I thought that it would be a great opportunity. I mean, I was booming. I was doing great in my career for the FQHC. My clinics were high performing clinics. My staff were high performing. So when I saw this opportunity, I began to look into it and review it, did some research, and I was like, oh, wow, this is awesome. And I pretty much just came on the board. I began to have a connection and a bond with the staff. And like we mentioned, Dan Kessler was my mentor. He has a model organization at Disability Rights and Resources, and then just my own personal experiences with family members and friends with disabilities, even losing my twin sister at the age of 17 to cancer. So I just knew that this was the right fit for me and the right place for me.
Yeah, I'm sorry to hear about your sister there at 17. I'd like to ask a little bit of a follow up question there. You said the breakthrough was in 2015.
Yes.
There may be some individuals that are watching or will watch in the future that are wondering what their breakthrough looks like. And so I'd like you to, before 2015, were you wanting to, climb a little bit of the corporate ladder there and do more leadership positions? And how did that opportunity come about? Were you constantly seeking it out, or did somebody say, hey, you should check this out?
Well, what the breakthrough looks like is you finally get that chance. You finally get someone that you're sitting across the table from, that you're having a conversation with, and they actually believe in you. So prior to coming to that organization, as I did state, I was working a lot of entry level positions, and it was like I was hitting a brick wall. I felt like I couldn't get out of that situation. I just couldn't get past entry level positions. Of course, I had to relocate because at the time I was living in Birmingham. So I had to relocate, and I had to do a lot of compromising. But I did find something that was my introduction to management, to being a manager, and I stayed there for about 4 years. But when I say I had to make compromises, I of course I live in Madison, and these the main headquarter clinic for my area was located in Decatur, Alabama. So that was a 25-minute commute, and like I did mention, I did have to manage a total of 3 locations. So I would have to commute some distance. And I had to, sometimes you have to give. So I had to give in order to finally get where I wanted to be. But that was my breakthrough. That was like my breaking point, that moment. And if anybody's interested in, climbing that ladder, I would just say stay persistent, keep going, keep looking, become resourceful, do your research. You may have to make some sacrifices. It may not always be the perfect or ideal situation, but you will end up there if you keep pushing and keep trying.
I love how you say that. It's like being ready for the opportunity when it presents itself, that you got to put in the hard work so that when the opportunity does come, you're prepared for it. It's like success never, you never think of success as looking like overalls and doing work, but oftentimes it does include putting in the time and getting your hands dirty. So when that opportunity does present itself, you can jump on it. And then
Absolutely.
the universe conspires. So you got to put it out there. You have to make it known,
Got to.
and talk about it with other people and friends so they know that you're actively looking. And a lot of times your support network can kind of, throw some bones your way, to so to say. And
Right.
then I'd like to ask where you saw the opportunity for the executive director of Disability Resource Network. Was that like an online thing that you stumbled across, or how did that go?
I did. I saw it. I saw the job posting online. Like you said, I was actively seeking employment, advancement outside of the company that I was at. And so I did see an online opportunity. I saw it posted multiple sources. And when I saw it, I applied, and I think I followed up. I called Dan a couple of times, and we talked. And he called me back a couple of weeks after I initially called him and said, "Can you drive down to Birmingham so we can have a conversation and talk a little bit more about the position?" And I said, "Sure."
That's amazing. Now, were you a little bit nervous about the whole process? Because I know a lot of individuals that are entering the workforce, either transitioning from education. The hiring process can be one of the hardest things to do. And so, what would you recommend for maybe individuals who receive services that are looking for employment opportunities? What would you kind of coach them from your past experience?
For build that resume, build that resume with relevant experience. Even if you don't feel like it's relevant, it can go hand in hand. Like I said, I had so many entry level positions, I didn't even feel that I qualified for a management position. But it's all about how you word things, is how you present yourself, is being resourceful, is doing a lot of research. Um, it's about, like you said, making those connections. It's about networking. When every job I interviewed, I not only applied for the position, but I did my research on the position. So when I went in there, they felt that I was knowledgeable about the job and knowledgeable about the culture and the leadership and the people that were at the organization. So I had already done my background on most of the jobs that I applied for. So when I went in, it felt like that I was already a part of the team.
I like that you say the research behind there. Funny story about Alabama Care. So we are funded through the Alabama Council of Developmental Disabilities, and the way that we got that grant is they put out a request for proposal, and they put out a
Mhm.
request for proposal in 2018 for innovative ideas. And I was like, I think someone should go around and interview experts and do it in video format so that people that are looking for the information can go back and rewatch it. do it live so you can answer questions. By the way, Sarah Williams, hey y'all in the chat, appreciate you being here. But so we
Hey.
we wrote the grant proposal and didn't hear back
Mhm.
for like 2 months, nothing, no word. And then
Right.
they sent out another request for proposal that was almost the exact same for innovative ideas. And I was
Mhm.
like, well, what are they really looking for here? So then I called, and it was Myra Banks at the time that was the executive director of ACDD. Went down there, met with them, was like, okay, I have a better understanding of what ACDD is and what they're looking for, and we rewrote the grant, and then we got it. But I share that just because, if you don't get things the first time, or you don't get a call back, be persistent with it. Ask follow up
Absolutely.
questions, and oftentimes if you just break through that initial, most people won't do that. So if you can get some
Right.
FaceTime, be a little bit more persistent. Now you mentioned that having your resume and the wording in there is important to kind of stand
Mhm.
out from other possible employees. Is that something that you guys do at the Disability Resource Network, is help individuals kind of go over their resume?
Absolutely. We're peer advocates and myself, and that is something that they're able to do with a person that's seeking employment and that would like to improve their resume writing skills or just need some input or insight. That's exactly what we're here to do.
Kind of a sounding board there. I think it's
Yeah.
really important. Anytime that I write like a grant or anything like that, I always have a couple people read it. I hate writing. I'm one of the worst writers, and so I usually get it back, and they're like, "You need to put commas everywhere in here. That's not even a
Yeah.
sentence. What are you doing?" So I always like to get that feedback from myself. Now you mentioned that they're currently at Disability Resource Network. It is you, and you have two team members. And if
I
you would
do.
kind of introduce them and their roles in the organization.
Yes, I will, and hopefully, I spoke with your team. You guys can bring them, and so that you can speak with them and speak on their perspective of their role as a peer advocate and some of their day to day work that they do. But yes, I have two staff members along with myself, Deshaun Washington and Katie Turo, and both of them at this time are peer advocates. And they're awesome, by the way.
And one of the things that I noticed on the website is Disability Resource Network is a consumer controlled organization. And if you would kind of
Yes,
talk a little bit about that for the employees and for the board.
absolutely. So 51% of our staff members and 51% of our board members are people with disabilities. So people providing the services and people that are making the decision makings, they are people with disabilities.
Which I think is so important. We talked about that mentorship that you had with Dan Kessler. And there's my dog in the background. She's making a
So
cameo. But is important to be able to speak with somebody that's been through it or has similar experience to kind of coach you through that process. And by having an organization be consumer controlled, it guarantees that there's never a lack of connection there with the individuals that you're serving. We try and do that here at Alabama Care with our team. We want people with experience, either for an individual that has a disability or a family member, so
mhm.
that they're knowledgeable about what they're talking about and can kind of ask the right questions there. So I love that you guys are doing. Now, is that a requirement for all independent living facilities?
It is. It's a
Okay.
part of our philosophy. It's a part of if you, I mean, you have to adopt to the independent living philosophy in order to operate as a center for independent living. So it is a requirement. Now they can have. It's not a certain disability that they can have. They can have an invisible disability. It can be any disability, but that is a requirement that 51% of the staff and 51% of the board members are people with disabilities. It's no
You had
different than I've met different veteran organizations and they employ veterans, so it's kind of similar to that model.
Mhm. Now you mentioned invisible disability. I heard a statistic the other day. There's someone on my
Oh.
team that said almost a quarter, or roughly 25% of Alabamians have a disability. So what is an invisible disability?
An invisible disability is something like is also called a hidden disability. Most people, when they think of disability, a person with disability, they think of a physical disability, something that you can see, a wheelchair user, someone that has a cane, someone that you can physically see that's legally blind. But someone with a invisible or hidden disability, you can't see that. You can't see that someone has depression, anxiety, diabetes, sickle cell. You can't necessarily look at them and tell that they have that.
Hmm. And then at that point, you want to help, but it's really up to the individual if they're willing to share their struggle. A lot of times,
Right.
like in the past 2 years with the pandemic, I'm a very outgoing person. I like to be around people. I like talking with people, and kind of in the isolation, a little bit of depression snuck up on me. And so and
Mhm.
you don't really want to talk about it. And so it can be hard to help those individuals. But what would you say to somebody that's like, I could be receiving services, or I should be, and it could really help, but I'm nervous about saying that I need help.
Just try to walk them through that. This is a safe space. This is a place that's free of judgment, and just encourage them about our history and our philosophy. How we're here to empower people with disabilities. Everything that we discuss is confidential. We're going to develop a plan where you're in control of that plan. So it's you setting your own goals, and you'll be working with a peer, someone that actually has a disability. And I think once people understand that, their comfort level, they'll be more comfortable with that and more open to working with us.
Yeah, and I feel like in the beginning, it's almost like an attorney-client relationship or a therapy session where just be yourself, and and get comfortable around here. We want to help you, and before we throw like some final goals of this is the plan, this is the process, we got to get to know each other a little bit. So maybe
Right.
if you reach out the first time or come into the office the first time, don't feel nervous at all. It's just us getting to know each other. Now, are you guys seeing in person, or are you doing just virtual at this moment?
At this time, we are working remotely. We're doing virtual remote work.
I feel like a lot of companies are doing that. We're starting to transition a little bit more to in person, um,
Okay.
but it's kind of like a roller coaster. You feel like you can kind of go to more in person, and then a whole another caseload of coronavirus pops up, and it's like, no, we're only doing virtual again.
Yeah.
It's been crazy. So how many individuals do you serve, or have you served in the last year?
This year, we just started 2022, but for 2021, I do have our numbers, and we were at approximately over 50. I want to say about 55.
Hmm.
So we're new, and people still learning about us. But we did get some intakes, or we did have some interaction.
Yeah, and so the 50-55, what does that interaction look like? Is it more of like a one-time meeting, or is it more of a 3 month, 6 month? And I know they vary, but if you could
Yeah.
kind of say on average, is it a few months, or more like a couple years?
Well, it depends on what the consumer is looking for. Some people are just passing through. They're just looking for what we call information and referrals. So they're just looking
Hmm.
for resources. And then you have people that are looking for a service that we offer called independent living skills training. Well, that person, they get to set their own goals. It's individualized, and it takes as long as it takes for them to complete it. And if they want to set a second goal, then we could extend it longer. So
Now, what are
it
are the
varies.
all the what are all the services that are available through Disability Resource Network?
Well, we have five core services. We have independent living skills training. We offer information and referrals. We do peer support. We do transition services, and that's youth transition and nursing home transition. And we also do advocacy, and that's self advocacy as well as systems advocacy.
And what would you say is the most popular service that you guys provide?
Right now, as a new center, we are getting a lot of information and referrals. We get a lot of
Mhm.
information and referral calls.
And over the next year, which service would you like to see grow the most?
Probably the independent living skills training.
Yeah.
I really would like to see that one grow the most.
Yeah, I feel like it's going to kind of pop off for you. There's the new community waiver, community living
Program,
waiver,
yeah.
where it's encouraging individuals to stay in their home environment or have their own place. And I feel like a lot of those independent living skills are going to be needed to help that transition happen. I think there's
Absolutely.
five. I think there's 500 new waiver slots, and I think they have still have like 200 open or 250 open. So
Okay.
it's going to be necessary there. Now, I'd like you to highlight a success story that the Disability Resource Network has had here in Alabama.
Well, the first one that comes to mind is we had a consumer that was seeking transportation services, needed some transportation from their home to their doctor's appointment. So we connected the person with a transportation system here called Handy Ride, and they were able to receive transportation services to their doctor's appointment. So I think that that's a great success story.
To be
How
able to
our
get that
center was
medical,
able to connect a consumer to a resource that they were needing and looking for.
you have to be able to get to your medical appointments.
Yeah.
You need that medical attention. You got to get blood work done. You got to get your checkups done. Transportation is consistently popped up on a number of broadcasts that we've done as a
Yes,
service that needs to be enhanced, especially for the disability community. Um,
absolutely.
what are your thoughts on that? I mean, we have some Ubers, we have some ride shares, but it's still struggle.
Yes, yes. So transportation, we're here in the South, Alabama, and it's our transportation system is definitely not as advanced as larger cities that have 24-hour transportation. And that's the thing, sometimes the schedules just isn't in alignment. It's not, if somebody needs to go grocery shopping or they work and they get off at late hours, they're having transportation issues, they don't have a ride. So I think that is in Alabama is not as advanced as other places, the public transportation system. And then when you talk about people with disabilities, if it's someone with a mobility issue, how are you going to get your wheelchair on the vehicle? They have to make sure that it's accessible for people with disabilities as well.
Of a give and a take. I love living kind of, and I live in McCalla, so it's a little bit more rural than like a
Yeah.
downtown Birmingham. But I grew up outside of Philadelphia, and I lived in Phoenix
Oh
for a
yeah.
number of years. And I was just back in Philadelphia, and we took the train down to the city, saw the Liberty Bell, did all that. And thinking about Phoenix, there were buses pretty much all over the city. But you get that hustle and bustle of a big city, and
Yeah.
you get the transportation. Um,
Hmm.
but I've lived in a big city before, and I can tell you I like living in a little bit more rural area right now. So
Yeah.
it is a give and a take there.
I'm sure. I mean, I
Now,
have colleagues and friends that live in like New York and places like that, and they've even told me, they don't even need a car to live in those
yeah,
places because they're able to use public transportation and access it at any time of the day, and that how having a car is just a burden for them. Park is just so bad.
I don't think I'd want to have a car living in New York.
Yeah, I wouldn't either.
Parallel parking all the time. Everyone's honking at you. So when an individual contacts the Disability Resource Network and requests services, they may be thinking, well, I'm receiving something from this company. Am I going to have to pay anything out of pocket, or is insurance going to have to get involved, or what does that look like for the individual?
Well, we're a Part B center, so we receive state funding. So just our core basic services that we have now, they're covered through our grants. However, if we add some additional services at some point, now those may require something different. But just our general core services that we have at this time, um, it's just it's open to anybody and it's available to anyone with a disability.
So I always like that most people say free. Oh, it must be free. When that implies that there's no benefit from it. And so it's
Mhm.
almost like it's at no cost to the consumer. Um, I think is a good way to put that. You mentioned
Yes.
that if you do add additional services, there may be a fee associated with that. What is an example of an additional service that you could see DRN have?
Well, some kind of way, I would like to offer transportation services. I think that's very much needed. Transportation services or housing vouchers. We have a big housing issue. People finding accessible and affordable housing. So, if there's some kind of way we can work with other agencies or programs to provide housing vouchers, I think that would be a great service to offer.
Yeah, I agree. Affordable housing. I mean, you see the home prices keep going up and up and up, and it's
Right.
like a lot of people are asking, "Will I ever own a home, or am I just going to?
Yes.
Will I forever rent, or
Mhm.
what that looks like?" And so I think that's a big thing with the transportation. I have heard a few ideas of partnering with like local churches on some of their vans, their
Yes.
big cargo vans when they're not in use, and I thought that was a pretty unique and creative solution there. But I haven't heard any follow up from how that went. So
Okay.
I think that's a good one. And what's the vision? What are some challenges and obstacles that you guys have over the next year or two that you're looking forward to conquering?
Well, we're a new center, like I stated, and we have a 13 county service area. So being responsible for so many counties, and being located in Huntsville can sometimes be a challenge, because some of those counties are rural counties. And so just getting the word or servicing the individuals in those areas can be a challenge because they don't necessarily have the resources that people in the inner city may have, like Huntsville. And then some of the resources in Huntsville, or they only service Madison County, so it wouldn't be available to someone that lives in Lauderdale County or Limestone County. So that can be a challenge, for our center, just having so many a big service area and it just being so diverse and different.
If there is a silver lining to what we've had over the past few years with the coronavirus, there's a few things. One is that the number of individuals with a disability that are getting hired is going through the roof. And so I think it's a great opportunity there for employment. And the other one is kind of this Zoom culture that we have where we're more likely to get on a Zoom call. And I think that
Mhm.
expands our reach to some of these more rural areas as long as
Yes.
there's a way to connect to the internet there. And you guys are
And that
definitely
that
taking
can be
advantage.
another, yeah, and that can be another barrier. The bandwidth, people having access to computers and internet and Wi-Fi, just technology. So that can be a challenge as well. I had a consumer that called me one time and didn't have Wi-Fi, had to drive to a Starbucks just to kind of feed off of their Wi-Fi, just to
Mhm.
make a call to me. So and they lived in a rural county, like I said. So that's definitely a challenge, and
And
we're
I think
aware of
that,
it. We're going to work on it.
yeah, and that's a statewide thing. I think they're tackling that. They're throwing a decent amount of money with getting the high speed out to the more rural areas. And I think we'll see that in the next few years. But that really came about and prominent to the front when schools started, closing down, and the students had to be at home to connect. And if they didn't have a connection, they were falling behind. And
Right,
you can't. That's inequality. You can't have that inequality
right,
of opportunity. Um, you know.
absolutely.
Heather Sims, who is an employee of DRR, I'm sure you're familiar with Mrs. Sims,
Oh yeah,
says, I totally agree. Housing and transportation are much needed. So those are big kind of things that we're tackling at a state level, but trying to get done at the local level as well.
right.
Now, as we kind of come to a close today, are there any upcoming events that you would like to shout out to the community and would recommend they attend?
Absolutely. So January 26th, which is tomorrow, we will be doing a peer support hour, and it will be on Zoom. The Zoom platform is at 10 o'clock a.m. and it's posted on our social media. There's a link. We also have, we'll be featured on a podcast tomorrow at 1 p.m. Silent Warriors Chronicles, the Social Workers in edition. We also have some upcoming podcasts that we'll be attending. Our quarterly community education, we're probably going to schedule that within sometime within this first quarter, probably be February or March. We'll also be featured in South Huntsville Neighbors Magazine in the February edition. So be on the lookout to see DRN in that publication.
Definitely getting your name out there. That is quite a bit of
Absolutely.
appearances, which is important to let the individuals know that their resources there is available in Northern Alabama. Now, for tomorrow, you mentioned there is a Zoom meeting. What does that look
Yes.
like, and what will be kind of discussed during that Zoom meeting?
Well, each month we do something what we call a peer support hour, where we invite people with disabilities, also allies and advocates, to join in on a conversation of topic and just have like a social hour. It's just a way for us to just connect and bond and just to discuss issues that's going on in the community, or what's going on, in your world. So
Yeah.
tomorrow our topic is going to be COVID. COVID is something that we've all been experiencing for a while. We have a couple of grants. Have a couple of grants. Alabama Department of Public Health. We're also working with um, Department Vaccine Access Opportunities on some COVID trainings and workshops that we're supposed to be hosting, and trying to work with local agencies and health departments on how to have access for people with disabilities to get the COVID vaccine. So we'll be
Mhm.
talking about COVID tomorrow.
Yeah. Well, that's a good subject to talk about right now.
Yes.
With the boosters available and everything, highly recommend everybody take care of themselves, do everything that you
Yes.
can to stay healthy. Um, and so that's a great topic. And we'll go ahead and put that link in the chat so people can kind of register from there if you're okay with that.
Absolutely. Thank you so much.
Awesome. And as we come to a close, is there anything that we haven't talked about that you think an individual with a disability or their family would benefit from hearing about the Disability Resource Network?
I think we pretty much talked about everything. We just want to increase our awareness in the community, let you know that we're here as a resource to assist you with. I think one of the things that we really want to get out in the community is that we're a non-residential facility, so we're not a group home, or we're here to promote independent living, to make sure that people with disabilities are living independently, and we're here to support them and be a resource and give them the tools that they need to operate and function as an independent, to be independent in society.
Yeah, and as an individual, you got to contact DRN and thinking
Yeah,
I'm the driver of what my life is, and they're going to help me get to where I want to be. So please utilize
absolutely.
utilize Disability Resource Network. And as you can see, Mrs. Davina Patterson, very welcoming. We'll go ahead and put your number and the website link in the chat as well. So,
Okay.
well, Mrs. Patterson, I greatly appreciate you spending the time with us this morning. And at this point, we'll go ahead and give our cameras a little wave, and we will set up another broadcast with uh, Deshaun and the peer advocate.
Deshaun.
Yeah, maybe we'll
Deshaun
start off with.
Washington and Katie Turo. And they're awesome, by the way.
So we'd love to have them on and kind of get their experience working with individuals as well. So
Awesome.
at this point, we're going to give a wave and we'll say, see you next time.